Welcome to TVC Sunday Specials. Perhaps the most effective way of checking the spread of the coronavirus is to know who is infected. And to find this out, as many tests as possible must be carried out to help detect carriers and send them in for quarantine. But testing is not cheap. In this report, we examine the cost of testing against Nigeria's actual capacity to undertake that task. For Nigeria, the initial 14-day lockdown imposed on the FCT and Lagos was long overdue. The strategy, according to the president, is to identify, trace, and isolate all individuals that may have come into contact with confirmed cases. But a more effective strategy would be aggressive testing of as many Nigerians as possible. This is essential because of the following reasons. 1. Nigeria only announced the restriction of international flights into its territory on the 18th of March, 2 months after the first cases were first treated in China. 2. The Commissioner for Health in Lagos State, the most impacted with the virus, had admitted to government's inability to identify all the passengers who had boarded the same flight with the Italian, who was Nigeria's index case for the coronavirus. Little wonder then that 3 weeks after the first case was discovered, Nigeria is now recording at least 5 cases per day. In view of the current circumstances, testing kits are the new essential, scarce, and costly commodity.
We have a $1,331 expense, conservatively, just for testing for the coronavirus.
The WHO has urged countries to scale up their testing capacity for the virus. But Nigeria is lagging far behind in testing for the virus. The current cost of testing, according to Nigeria's Minister of State for Health, is 10,000 naira, an equivalent of $26.69. In India, it is $78.63, and the US, $1,331. 10,000 naira per patient for the coronavirus test is not cheap for a country like Nigeria, where that cost is 1/4 of the minimum wage. And although the cost is borne by the government, not the carrier, where will government find the resources to test a good portion of its 200 million-sized population? This is critical in view of the downward slide in the price of crude, the main source of funding for its budget. The Minister of Health has announced Nigeria's increased capacity to test.
These are not emotional decisions. If we have the capability to test 100,000 people, we would announce it. But the simple truth is that we don't at the moment. We are building up our capacity, so we don't. So what we are doing is focusing on those that need it the most. And that is our strategy. So we need to focus on those that need it the most. We're not saying we won't do this in the long term. Like I said when I spoke, there are many efforts to increase testing capacity. As we do that, we may review our strategy. But at the moment, we're focusing on those that need it the most in order to make sure that we don't have too many severe outcomes.
1,500 tests per day is equivalent to 1.5 per 1 million people, the lowest testing rate in the world currently. And for a population of 200 million, 70% of whom are active youths. The result of this increased capacity for testing is yet to be seen because Lagos is still chasing 2,000 suspected cases of COVID-19. Still, Nigeria must take its cue from countries of the world that have ramped up their testing for the coronavirus. Countries like China, source of the virus, Germany, and South Korea that have been able to get ahead in the testing curve because of the experience gathered from containing past viruses and the pattern of the spread. The activation of the virology laboratory of the Alex Ekwueme University Teaching Hospital in Abakaliki, Ebonyi, brings Nigeria's testing centers for COVID-19 to 7. Still, the country's testing infrastructure may be underutilized as there are other structures in Maiduguri, Kano, Sokoto, Port Harcourt, Jos, and Kaduna yet to be activated, according to the Ministry of Health. As it stands, the providential silver lining for Nigeria is her significantly low death rate, which Nigerians can only hope will remain the same.